and we're going to do that PRN, or the doctor may say, I want it done once a day, or whatever. You can kind of look at it and tell when it's going to need.
A lot of times the patient will go, suction, you better do it. They'll tell you they need it.
And do you think these can get kind of smelly?
Yes.
Yeah. My Trach Care kit is going to differ a little bit from yours, and that mine come with the solutions. Yours don't. So for Trach Care, we're going to need saline, and we're going to need peroxide. So you can just gather these if you need them and have them by the side. They usually are either 2-chambered or 3-chambered, right? And they give you a lot of cleaning supplies in these. So if a patient's lying in bed, we're going to assume he's lying in bed. I want him sitting up as it's more going to be for me, my ability to be able to get here. Do you think some patients are going to have thick necks that are hard to clean? You've got to keep that in mind. He's got a nice smooth one. This is sterile, so you want to open it just like you did your sterile packages. And this flap, I like folding it under. All right. In this trach kit, look at that. Look at those sterile gloves. Remember I told you sterile gloves are going to get where they're all wadded up? Look at that.
Just slag.
Huh?
It's just slag with the manufacturer. Trying to make it hard for us.
Remember I told you you're going to have to look and see what you have? Yeah. Now, because everything in here is sterile, correct? I can go ahead and put my gloves on first. I think what I'll do is I'll take out the solutions since that's what theirs are like. What do you think?
Either way, they, hopefully they,
I'm gonna take out the solutions so that it's just like yours. Okay? But since mine have the sterile solutions, I could go ahead and put on my gloves. Now, this is basically what yours is gonna look like. No sterile solutions. So, what we have to do is we have to prepare our solutions first, okay? And I'm going to grasp in yours, the drape is gonna be on the top, okay? So I'm gonna go ahead, I'm gonna pick up my drape just like you do with your Foley kit. This one happens to be blue on one side and white on the other. Okay? Now, you can put this across the patient's chest.
I'm sorry, you said you have your gloves on already?
I do not have my gloves on.
That's okay.
Okay? Right there. I think your gloves come in the wrapper. I'm going to go ahead and I'm going to take my supplies and I'm going to turn this over and drop it on my drape.
That's on top of his chest?
Yeah. If you have the glove wrapper, it's nice if you have your glove wrapper and you can drop your supplies on your glove wrapper. But guys, it's all problem solving. We're not telling you one exact way. Yes, Shay?
So is he supine or is he Fowler's?
Huh?
Is he supine or?
I probably would have him as semi-Fowlers. I probably would have him up a little bit. Okay.
it would definitely not be laying down.
Okay, I was just wondering, jumping stuff out, I'm worried about it rolling off. I was picturing him sitting up.
But there again, like she said, all of this you kind of have to think your way through. There's 10 different ways. We try to show you one that works, but in real life you're going to do it 10 different ways. So
If I had my-
the biggest thing is do not break the field on anything that you do. You can do it any way you want to do it. Don't break the field. That's the only thing.
So we could have a table like that in front of him?
Yep.
Okay.
And you can have your glove wrapper. You know, remember how we always say you can use this as a sterile field? You could have the drape over him and drop your supplies on the glove wrapper, which probably would be the best option. But with this one, I don't have a glove wrapper. I could also use my drape. I can touch it from the bottom, right? I could use my drape right here, and I could put a towel over his chest. Does that have to be sterile? No. Does that make you happier?
Yes, ma'am, I'm sorry.
That's okay. It just shows your thinking. You've got to think. That's why these skills get increasingly more difficult, because there's not one right way. Okay?
What's the most important thing?
Do not break the field.
Don't break the field, okay? That, there's no way around that. You cannot go, oh, I critically thought my way out of it being a sterile procedure. No, you can't do that. You've got to keep the sterile field.
Right. And it's helpful to have a garbage can right nearby. And you have to look for the cuff of your glove. Okay?
Why is the drape sterile if you don't need a sterile field under it? Why is the drape gotta be sterile in the first place if it's just going under it?
I was thinking that the top part has to be.
It really doesn't.
She just used it as a field to put her stuff on.
That's why we need it.
These are like gloves in the deli.
True.
Right? Now I can touch anything in here. I can separate. In your kit, you will have different things to clean. You'll have a little brush. You'll have, I don't know that you have pipe cleaners. You may have pipe cleaners, swab sticks, and a tie to go around his neck. This one happens to have a little sponge that we could use for padding purposes. Your kit doesn't have that. Okay. Now,
What would you use for a pad if you needed one and you didn't have that? Just gauze, right? Thank you. Good, good.
there's so many things you can use, okay? Now, I am going to contaminate one hand, right? So I'm gonna lift my saline. With your saline, you're going to, and I really should have done this before. Would you open this for me, please?
So those should be open before we do sterile ones?
Yeah.
just One hand sterile.
So I'm gonna put saline in all three of these. Okay. And I'm gonna put peroxide in one with the saline. So we're gonna have saline and have peroxide.
Why do you think?
Clean.
For clean, but why half and half? Why not just all peroxide?
Diluted some.
You want to dilute it some, okay? It's gonna really be strong if you don't dilute it a little bit.
And we're not using the peroxide to clean the patient's skin. We're using the peroxide only to clean the inner cannula. I'm gonna use my contaminated hand, unlock it, which is turning it counterclockwise. I'm going to drop that in my peroxide. Okay. While I'm taking that out, I'm also going to take out the old dressing. Now, this is up to you. You can do one of two things. I can go ahead and clean my cannula, or I can go ahead and clean the skin around the stoma. Okay? Notice I leave the tie in place. Why do I leave the tie in place?
If it coughs, it'll come flying out.
It'll come flying out. You never, ever, ever leave this unsecured. If you want to take this off before you put the next one on, you have to have another person now holding this in place. Okay. I'm going to go ahead though, and I'm going to go ahead and clean my inner cannula. So I'm picking this up by the outer cuff or the collar with my dirty hand, and I'm keeping the cannula itself sterile. You can use this, you can clean the outside with it, you can clean, you can go down.
What does the little brush do when you pull it out, y'all?
Just spray.
Be careful.
And I told my students on Wednesday, I said it dawned on me last semester, this is like washing dishes.
Yeah.
You put them into soap, you wash them. Now I'm going to rinse them, so I'm going to put it in my other saline, right? Rinse it real well. Then tap it on the inside here. Okay, I've rinsed it. Now I'm going to dry them. I'm going to get rid of this. Where can I put this? In the trash. I can use one of these if I want. Dry it. I hold it up to the light to make sure you don't see any fluid in there. Because if you ever swallow just inhaled a tiny droplet of liquid, what does it do? It throws you into fits of spasms. So, you soak your dishes, you wash your dishes, you rinse your dishes, you dry them, and what do we do after we dry them? We put it away.
You would use the pipe cleaners to dry the inside of it too, can't you?
You can. And I'm gonna lock it into place.
Now, y'all, are these gonna be like kinda dirty, or like really dirty, or what do you think?
Depends.
Really dirty.
It depends on the patient, but usually they're gonna be crusty, okay? They're gonna be, it's hard to clean them, so you make sure you take the time and do it right.
It's like a child with a runny nose that can't blow their own nose and clean. It gets crusty and
Keep it going.
keeps going. Now I'm going to go ahead and clean around the stoma.
Are we still have the oxygen off of them? So do we need to?
We might have the oxygen propped up right here.
Okay.
It's not over it, but it might be nearby so that they're getting
Something.
oxygenation. If they have oxygen ordered, they may not.
Okay.
Okay?
I've had patients tap me and go, "Listen, you need to give me some O2.
Okay.
You know?
They'll let you know, hopefully, if they can. Okay. Now, we can use these. Now, I had my third chamber of saline, right? That's going to be for cleaning the skin and the stoma. This is my contaminated hand. I can use this to hold the faceplate, and you're going to do stoma out. Stoma out, right? You got to get up underneath that faceplate and work your way out.
Now, Ms. Klauber keeps saying stoma. What is it actually, y'all?
It's an
Artificial.
opening.
It's a hole, right? It's an artificial, but in this case, if you take that cannula all the way out, there is a little round hole about that, and it's big, in their throat, right there. I mean, you can see it without question.
So you just went down, you said?
Right, start at the circle and move our way out.
Yep.
Okay.
Then I can take my 4x4. You can use whatever supplies you need to. Wet that, clean around there. Do you think the faceplate might need cleaning?
Yes.
Yep. Do all the cleaning that you need to do. See how I'm keeping my hands above my waist? Then I'm going to dry it. And then I've got my drain sponge with the slit in it. You see I'm touching it on the outside? You think this is going to be hard to keep sterile? Now, I'm gonna use my contaminated hand to touch the side away from the patient, because you just have to work it up under there. There's just no other way to do it.
So if you had a second person, it'd be a lot easier, wouldn't it?
Mhm.
What are the odds?
Not
too
likely.
much.
They're gonna be taking care of their patient.
Well, we could have our female lady help us.
You could have. But they'll make eyes at you. That's your job.
Did it rip?
No, it's just twisted.
Okay.
And this is like it is in real life, y'all. It's hard to get the thing under there. Let's just say it.
Okay? Now, I'm not gonna take my gloves off yet. I wouldn't. But I'm going to find my scissors,
Those will already be out, I'm sure.
ideally. Now, you can use, a trach. Let me show you this. This is really nice because on some of the mannequins, this is just Velcro. And this would go around the back of the neck. You see, I haven't taken off the one he's got because I'm by myself. And you see how it has a little angled cut? That just helps you get through that little hole. You go enter it from the back side.
And this thing can be a battle, okay? I mean, it can be really hard.
Because it doesn't want to bend. And you've got another tie in place already.
What are the odds, y'all, that it'll come out if you take that other tie off?
Pretty
Great.
good.
Almost 100%, because they're gonna cough or something.
I'm trying not to get right in front of y'all.
Where's it going?
Into
the little holes on the sides of the
Little holes on the side of the
You've taken away the immune effects of having nares and nasal hairs and
Yep.
brain.
That's right.
This is to hold it in place while you take that tie out? Is that what you're doing?
Right.
She's changing the tie out. So she's changing it out to replace it with a Velcro instead of a tie.
And then I'd have to adjust this one.
Basically put
Because
the
it's
new one on
loose.
while the old one's on, then take the old one
And
off.
then I can just snip the old one and take the old one off.
How do you tie the old one? Like just regular?
Hmm?
How do you tie that if that's all you have? Just
Okay, that's what I'm gonna show you now. Let's say this is the one he had on, and I'm gonna use the 12 tie one that comes with your kit. With this one, what you wanna do with each end, you wanna angle them just so that you have a little point. So take your scissors and cut your angle. Okay. Now, the best way to do this, because we don't want the knot right behind the patient's neck where it's gonna be uncomfortable, it can cause pressure. You wanna fold this with one side about 2/3 in length and the other one about 1/3 and 2/3. See that? And you're gonna cut it. And then you're gonna take the end that you just cut and fold it over about 1/2 inch, and you're gonna do a little snip. And what that's gonna do is that's gonna make a hole. See my little hole? And what we're gonna do is we're going to, leaving this one in place, I'm gonna come from behind, I'm gonna thread that through. I'm pointing in. And then I'm gonna feed it through the little hole that I snipped. Think this can be tricky with gloves on? And then give it a pull. Who would like to cut my next one? You gonna do it, Jada? If that's your straight end, fold it over about a half an inch. That looks good. And just give a little snip. Okay, good. And you're gonna go on this side. It's hard. And it's hard in real life. This is one of those things that doesn't get easier with practice. Sometimes it helps to have some hemostats, which are little
Yeah,
clamps
push it
that
through.
once you push it through, you can grab that little point with your hemostats.
You make it look so easy.
She always does.
While she's doing that, I wanna share a quick little story with y'all, I think might come and help, maybe it'll come and help me one day. When the lady was stitching up my little boy to distract him when the doctor, she deserves to be called about it. When she was stitching up my little boy, she handed him, saline flushes and told him, these are your little squirt guns, anytime I do anything that hurts you, you squirt me. You wouldn't believe how big time that distracted him.
So she got it. Thank you. And then because we have a short one and a long one, we now can tie it on the side of the neck. And you tie it on the side so you don't have your knot on the side. This is one of those where you tie this in a square knot, which is a double knot. Okay? Why are we tying a double knot?
So it will not come
So it will
undone.
not come undone. But you do want to be able to get your finger up underneath there because we don't want it too tight.
Now, was the Velcro one supposed to be that loose, or would it?
No, we'd have to adjust it.
Okay.
We'd have to cut it and make it a little shorter. Okay? And then I can take the Velcro one off. And these can get really yucky. Oops, and there I pulled out his this is a really, really bad drain. Usually they're nicer than that. Okay? That's it.